Hospital staff has just handed you a MOON form, or the Medicare Outpatient Observation Notice form, and you have been informed that you are under observation. What does that mean? Why do you need to know if you are an inpatient or observation patient? This video will explain what you need to know. First of all, let us assure you that you will receive the care you need regardless of your status as an inpatient or under observation. Medicare has rules that determine whether a patient should be admitted as an inpatient or seen under observation, both of which occur in the hospital. The only difference is how Medicare will cover your bills. So why are you receiving this notification? In the past, patients often were not aware of their status until after their hospitalization when they received bills for observation care. A new law, the Notice Act, requires patients to be notified that they are hospitalized as observation, and what that means in terms of their Medicare coverage. What does this mean for my financial situation? Observation is defined by Medicare to be an outpatient service even if you are in the hospital. The primary implications of observation are financial, not care-related. It is possible that you, as a patient, will incur more out-of-pocket costs being in observation compared to being inpatient. The other implication is that Medicare helps pay for skilled nursing facility if you are transferred there following an inpatient stay of 3 days or more. But if you are transferred to a skilled nursing facility after an observation hospitalization, you may be responsible for the cost of skilled nursing facility care after your hospital stay. Can anything be done that could ease the burden? As your care providers, we understand the burden this can place on you. Your doctors must abide by strict guidelines from what is permissible for inpatient versus observation, and this is often confirmed by another healthcare provider who specializes in determining the statuses of patients. If you do not meet Medicare's definition for inpatient, then your care provider cannot legally change you from observation to inpatient. So what can you do now that you're aware of the observation problem? You do have rights as a patient. You can ask to talk to hospital staff who can better discuss your personal situation and its financial implications. Usually there is a patient care department that can address this kind of situation. You can also let your legislators know that you are unhappy with the way Medicare handles this. Why legislators? Because they have control over Medicare and can change the rules. Is anyone out there fighting for patients who are under observation or trying to address this problem? Yes. Many physician societies, hospital associations, and patient advocacy groups are pushing for changes. Patients are not alone. Providers are also frustrated by this confusing system. The most important thing to remember when you are receiving this notification is that we will do everything we can to make sure you get well as soon as possible. The negative impact on patients and the frustration for hospitalists are why the Society of Hospital Medicine is leading the charge in trying to change observation policy as we currently know it.